county functions, of course, that were being performed by the national government and which were transferred to county government. So what does that mean? Either we had a lot of duplication, and we still have those duplications. For DLNet the same? Yes, the Gazette notice provided for that. The funds then ought to have matched and followed the functions. Has that happened? I will not respond because we are in this space together. I will just run you through some of the findings from that, some of the things that came out of that. We were calling it unbundling of functions. Within water, which is core to early childhood development, 58 billion remained at national level, and its functions that are being done at county level. And then I'll pick on health, 3.2 billion. Agriculture, where nutrition issues come from, 105 billion. In total, I'm just skipping the others because I'm looking out for those that affect us directly. If you look at education, for instance, there was no specific amount pulled out. Yet, we are all live to the fact that, because this has not been done, the costing for education has not been done, we need to do it, then we pull out and be able to say what would it then have costed to run an early childhood center. With all that, generally we have around 272 billion out there at the national level, either duplicating a function that is already being done by the county, or it could be over and, but let's just assume this is the figure. So what does it ask? Where does it leave us as a people? Assuming today we were sitting in this conference and our ask was, what would happen if we asked that the national government sent the 272 billion to county governments? This would mean we have grown our revenue. The projected revenue share in the coming years is going to be around 425 billion. If I had this, it comes around let me work averagely, 600 billion. It would mean even the wage bill we are talking about would go down, and the percentage we are talking about, the allocations, would automatically go up in as far as development is concerned and across the functions that we are speaking to is concerned. And this is just means not looking for any new resource, aligning the resource that we have within the government and allowing that each level is actually implementing adequately. I will not bug you with that. Let me jump quickly into this again, an interesting slide that again comes from government data on child poverty and our trajectory as a country. From this, I think this was done in collaboration with the UNICEF and the national government. Again, data from KNBS and the Treasury. And it shows that the Kenyan GDP grew by 43.5% between 2014 and 2022. Yet we same period, our poverty level slide on the children's level growing. It means the people who are affected are people who actually cannot speak for themselves. So most likely, they are the children. Again, what does it tell us? There's a disconnect between the economic growth and the improvement of the well-being, not just of the child, but of the population as a whole. Because then the question is, what do we need to advocate for differently? If the government, for sure, we are investing and we are doing infrastructure, does that equal to economic growth? Does that equal to improvement in the well-being of its population? Food for thought for all of us, because we are in spaces of influence and we could actually provide answers to this. Again, ask ourselves difficult questions. What is return on investment on the different populations that we engage? It's clear, again, when you invest in early childhood, the prenatal care, and the ages between 0 and 3, we have higher returns. But what are we investing in? We're investing in infrastructure and the higher education and things like that. Education is critical, but how do you invest in education for high school or university if you never invested in early childhood development, which is the core developmental stage of a child. Allow that I begin to summarize our thoughts into what I would call our call to action or areas of interventions that we may need to begin thinking through even as we reflect on our stakeholders. At the national level, we have the Vision 2063. Now we can't talk of Vision 2030 because it's coming to an end. What are we looking at? What is our strategy towards influencing that particular vision? How do we ensure that issues early childhood development are actually anchored either as enablers or fundamental groundings for that blueprint? Because we must actually ensure that the country infrastructure, it is for us to determine. Policy alignment. Does policy speak to each other? We were conducting a conversation with the State Department for Children's Services and appreciate them for good progress we've made in as far as the integrated early childhood development policy is concerned, because we've had a lot of back and forth and it's now at cabinet and we're hoping that we could make progress. It's through that we're actually even modeling a policy that counties can adopt, and it's all inclusive and encompassing. How are we aligning policies for the benefit of early childhood? The costing of early childhood development. What does it cost? Everybody tells their story, but nobody has actually sat down and said, this is the costing. We hope that in the next phase, because the government has spoken to this even at summit, that we need to undertake costing, that early childhood development would be at the core of the processes, that we could actually tell what it costs to run early childhood development, because we must invest in it. Of course, we've spoken to data in planning at this stage. We have spoken about the multisectoral coordination, both at national. At national level, we ask ourselves, we need to have an intergovernmental framework. And I'm glad 2 weeks ago when the stakeholders were meeting, the government, both levels of government were meeting in Mombasa, one of the things that we agreed on was to have an intergovernmental coordination framework for early childhood development. And we hope this would actually help us unpack the coordination within the health ministry at the national, the COG, and the different departments is for ease of coordination of even planning, because there's a lot of duplicity within that. And then also remove bottlenecks that allow for delay in implementation. And then of course, holistically, how do we advocate for equitable share to counties with all this in mind? So that then it is not just a request or a plea by the governors, but plea by the people of Kenya asking, can resources help us improve indicators? Planning like the CIDP guidelines, the State Department for Economic Planning helps us, and we work closely with them in ensuring that this is done. As we do the midterm reviews, how do we align? And I'm glad a number of partners, including UNICEF and others, are coming in and saying, how do we have a guiding principle for counties, that even as they do this midterm review of CIDPs, that we have a clear criteria for inclusion of early childhood, and what parameters and indicators can we measure thereafter. Within the county level, how are we modeling? And I'm glad a number of counties, including those of the Lake region, which we really celebrate, are doing an excellent job localizing policy. But then the question will be, once we have the national level policy, how do we domesticate or align what we have to the national policy? Because we've removed all the bottlenecks between and allowed that the policy is responding and giving the responsibility to the leaders within that level. Because when you're at a county level, you can't say children are for the national government at a particular age and they belong to a county at a particular age. No, the leadership they know is that which is near them, which is county government. And we are happy that the policy will begin then now to give that mandate to counties to provide leadership in support of early childhood development. Budgeting, I know we've spoken about it, but there's a lot to be done. We have budgeted, yes, but at execution, things fall through the cracks. How do we then track and ensure that what we plan for Those budgets don't go away direct, that's a profile like you mentioned in supplementaries, because that is the easy way to actually remove budgets. But again, for sustainability, we must begin to allow that the counties are planning for some of these. We've spoken about multisectoral coordination at national, the same at the county level. It's happening, yes, but then the question is who is designated for that coordination? I think a coordinated framework that is equal, that is standard would be very critical, so that then when you walk into a particular area, you know, I'm dealing with health, education, nutrition, but who is bringing us all together to ensure that that is working well? Critical to this conversation is issues of digitization. We need to have an integrated ECD data management system that actually acts as a repository for the integrated health, education, and social protection, all this together, so that then you're not looking for data all over. And I think it's one of those things that we're really driving at and looking forward that we could actually anchor some of this because it's already work in progress. If you have a fully working health data system and education standalone, you don't need to run all over. I hope we can do this together and see how do we then strengthen that in as far as data is concerned. And also having data for evidence and decision making. Counties developing statistical abstracts within their counties, it's a requirement that they have data to inform planning. Even some of these population data that are very clear within each of the counties, they can actually pull it out and utilize that. Again, as we move into a political space, we are already in it. The question again is, are the political blueprints, the manifestos that will be coming out, will they be speaking to early childhood development? And I think this should be one of those things we dangle to our politicians and ask them, where is early childhood development? I pray for a day, and this is me, when, allow me to use this word, when we will say ECD is a sexy topic for a politician to campaign with, because they would see what's coming alongside it. And then, of course, capacity building for our communities to engage better, to undertake behavioral change in as far as home hygiene and everything is concerned. And then, of course, integrating ECD into the already existing frameworks, including the social protection programs. And I pray also that we could draw away from making ECD program based, so that, but it becomes an initiative that are driven within the services that already needs to be provided, so that it's not just hinged on a project and when that project ends, that is it, but we could actually make it sustainable within our planning. And lastly, but not least, important that we document. A lot of good stories have happened within the networks, but the question is, who is telling our story? Our story can only attract financing when somebody knows it and can be scaled up to other counties. Otherwise, when we keep it amongst ourselves, we're not doing ourselves justice. How do we build on one, then it's helping another? And I'll use this within the knowledge sharing within COG. We had a case of Muranga doing very well in dairy. And we were very excited about dairy farming in Muranga, and it was doing excellently well. People from my county, that is Nandi County, went to visit Muranga County, and the question was, how can we be having rain and Muranga is beating us? Through exchange learning, now Nandi was doing much better in as far as milk production is concerned. And I'm not saying this because it's a competition. It's not a competition, but it's an opportunity to learn from each other and scale up. Through documentation of what we are doing, we will be able to scale results and allow that then other counties are able to learn from it. In close, allow that I ask us, how do we make ECD attractive today? It's time for us to build an investment case for ECD, even as we have these conversations. Because it's one thing for us to talk about it, and another for us to say, enough is enough, and this is what we are going to do. Specifically, we are having conversations at a time that is political. How do we then grab the attention of the politicians and say, look here, we are the civil society, we are the development partner, we are the government, we are the people, and this is what we want. How do we then package our case for ECD, not just for it to be on a paper, but for us to attract resources for the same. And then it's upon that that we can say we will now dive into how are we utilizing that resource in as far as governance is concerned. Unless we take our advocacy to another level beyond the county now and go to the being done, but I believe with what is happening, and if we just scale it a little bit, we will see a lot of financing in as far as early childhood is concerned within the county space. Thank you so much, and God bless you.
Thank you so much, Council of Governors, Eunice Feather, for that sharing, call to action, talking about the Vision 2063, telling us the gap between what we know and what we do. What I really liked was the statistics you gave, because that's some mathematics there that needs to be looked at and unbundled. And finally, that data speaks, and data is very important for evidence-based advocacy. So thank you so much. And now we'll give it the floor back to Abella. Thank you so much.
Thank you so much, Stella, for that session. I know it was a learning session for all of us. At this particular point, allow me to welcome the third moderator of the day, Esther Okello. Karibu. A round of applause for Stella and for Abella and for Eunice for the presentation we just had. Now, ladies and gentlemen, I'm glad that we are having this conversation here today. And I'm also glad that the way the program has been arranged is so that we had the previous speakers implementing on the ground. And then we have the Council of Governors with Eunice representing, giving us a very good discussion on how governance can be strengthened. And then now we come on board with a section of Kenya, the Lake Region Economic Bloc, executive leadership. And we are going to lead you into a panel discussion to see how all those items that we've been talking about can be done in reality and how to improve on this. So today's discussion brings together the county executive members who are representing the various governors of the various counties. From the Lake Region Economic Bloc, we normally say that if we have 6 counties representing, then the rest of the 14 counties are all here represented. Today, allow me to note that we have a representation from Kisumu County, Siaya County, Kericho County, Bomet County, both Kericho and Bomet County. The delegation are here under the leadership of the county secretaries. We have Trans Nzoia County represented by our very able director. We have Bungoma County. We have Vihiga County is on his way. And by extension and by representation, there is also Homa Bay County. So we will be focusing on the discussions that have been held before. And so it is good to know that we are uniquely positioned, just as our CEO had articulated earlier. The only item that he did not accept, but we need to allow him to accept, is that he has power because he's coordinating the 14 counties and there's a lot of work that he has been doing. So at this juncture, we will be bringing on board the various speakers. And like I said earlier, they are representing the various governors who are supposed to be with us here. And as the CEO had said earlier, due to some unavoidable circumstances, the implementers on the ground have been sent to represent them. So the first panelists we have, and you'll be giving a round of applause to them as they come, is Honorable John Awiti. You'll allow me to speak briefly about Honorable John Awiti. This is the only moment that we praise you for the works that you have been doing. So allow me, Honorable John, to say that John Awiti is the County Executive Committee member for vocational training and social services in Kisumu County, where he leads the county efforts to strengthen education systems with a strong emphasis on early childhood development and education. In this role, he oversees policies, programs, and partnerships aimed at improving access to quality, early learning, teacher support, and child well-being. Further, he has championed major investments in ECDE sector, including infrastructure expansion, recruitment of ECDE teachers. But above all, I've had an experience where he has established, I think it's the first county in LREB to establish a quality assurance and standards committee. So it's very important to take note of that. He's also a strong advocate for holistic child development, promoting nurturing care approach that integrate nutrition, health, parental engagement, and early learning. Aside from that, he has also supported multisectoral partnerships. Again, we were building up from the ESSEC leadership that he has been championing to advance school feeding programs, nutrition initiatives, and development of county ECD frameworks to ensure that children receive the support needed to thrive in their formative years. And to exemplify that, I know that it is in Kisumu County that we have yearly ECD competitions, and they normally leverage on the nurturing care components as their thematic area. So every year we have a yearly a component of nurturing care. Could be good nutrition, could be good health, and it's normally a very, very good competition, especially for the children within Kisumu County. So I'm welcoming you aboard. Come forward and take a seat. The next presenter, next panelist, we have Honorable Agnes Chipkorir Ngeno, the CCM Education, Youth, Sports, and Vocational Training from Bomet County. Honorable Agnes serves as the County Executive Member in Bomet County, where she provides strategic leadership in strengthening early childhood systems and education services across. Previously, he was teaching with a 15 years experience in education sector, and she also previously served as a deputy principal before joining the county leadership. Her current role oversees policies and programs aimed at improving early childhood development in education, including the expansion of ECD infrastructure. He has also championed initiatives that promote holistic child development that includes all the components that we are looking for. And through her leadership, Bomet County continues to prioritize nurturing care in early childhood development, recognizing that investment in all the components are key. Welcome aboard, Waziri. A round of applause as she comes until she sits. Until she sits. Let's continue clapping for her until she sits. The next in line would be one of the implementing partners that we have. Allow me not to read his bio because he has been here before, but of particular importance to the discussions that we have today, we are bringing on board Oscar Kadenge. And it's good to note that from the previous bio, before you step forward, Oscar, it's important to notice that through your work, you have contributed immensely to the design and implementation of community-based ECD initiatives, capacity building for frontline workers, and advocacy for policies that prioritize the holistic development of children in their early years. So it's very important that the insights that you will share builds into this discussion. Welcome aboard, Oscar. Let's clap for him until he gets here. Can we have stronger claps? Louder, louder. Thank you, thank you. Welcome aboard. The next panelist that we have is Professor Edgar Otumba from Siaya County. Allow me to shower you with praises. Dr. Edgar Otumba, now professor, serves as the county executive member for education, youth affairs, gender, and social services. You can note how different the different departments are named in respective counties. In his role, he provides strategic leadership for strengthening early childhood development system. Dr. Otumba has been very instrumental in advancing early childhood development and education in Siaya County through the various infrastructural development, recruitment issues, and professionalization of ECDE teachers and policy aimed at improving access to quality early learning. The county has prioritized initiatives that enhance enrollment, retention, and quality learning. Now, worth noting is that we like talking about Siaya County at all times because it is from Siaya County that we replicated the Smart Start initiative for the LREB Region Economic Bloc. In Siaya, it was the Smart Start initiative. It's worth noting also that indeed it was initiated by the first and second administration, but he championed the transitioning of that program from the second administration and very smoothly so to the third administration, and it has been very strengthened and running very strong. So through his partnership with the county departments, it is Siaya County that the multisectoral development has been very strengthened through this. Dr. Otumba continues to advocate for strong early childhood development that ensure every child in Siaya County receives a healthy, nurturing, and stimulating start in life. Karibu sana daktari. Let's have stronger claps for them. Thank you so much. So we're going to build from the discussions that we've had, and we have a very powerful team here with us. We've been talking about implementation. We've been talking about policies that are very well developed, but we need to bring them then to the ground and see to it that they are effectively articulated at the community. And earlier on, you realize that from the presentation that we had before, Eunice talked about 75% being youth and children in Kenya. So when you look at the population of Kenya, we have about 47 million. Out of that in LREB, we are talking about 16 million Kenyans. So it means that if we were to take 75% of 16 million, then that would give you an average number of the teams that we are focusing on. Then aside from that, if you're to go down again, you realize that we are talking about having about 2 million children whose interests we have and whose interests we are talking about here today. Now we have a number of items, number of concerns that we would wish that this team address. Like I said earlier, we have a component of Oscar who has been implementing on the ground, but then they catalyze government processes. So these are a very powerful team that have been working on the ground to see to it that ECD is effectively done. So allow me to start from Waziri, from Bomet County, because Bomet has done quite a lot in nurturing care for early childhood development. And my question for Bomet County would be very particular and designed in one of the wins that they have that sometimes in LREB we consider as a best practice. Bomet County designed and implemented an effective multisectoral nutrition policy that strengthens nurturing care for early childhood development. I would wish that Waziri would tell us what lessons we can perhaps pick from the experience on how this was effectively scaled across the entire county and how we can build on the same to support the Lake Region Economic Bloc, which for now we are using as a lever and also as an example that the rest of Kenya can copy from.
Okay, thank you very much, Esther, for this opportunity. I want to say I'm so glad to be part and parcel of this panel, and we are bringing on board what we are actually after in our early childhood development and even early childhood caring. So I'm glad to say that in Bomet, we have a population of 53,000 ECD learners that are actually still school going in the age of 4 to 5 years, which we have actually BB1 and BB2. In Bomet, what actually prompted us that is the nutrition that we were way above the malnutrition of the national, whereby we were having 22%, which is actually above the national or malnutrition. So in that case, that is actually what prompted us. And in Bomet, we have the school feeding program that we actually call milk program, which is a wholeheartedly, and it is actually a multisectorial, whereby we involve all the 10 departments in the county. We have the agriculture, we have also the health department, we have the water department, we have the roads department, we have all the departments coming in because this one we cannot do alone on our own as the education department. So what actually we are doing is that in providing of the milk, I remember the CEO when he was talking about somebody who implement into consideration, and he said that this nutrition, it cannot only happen when the child has been born. It started even before the child is born. That is immediately after the conception, there must be a balanced diet for the mother so that there will be an healthy baby. That is why we have in Bomet the high iron beans that is from the Department of Agriculture. We have the high iron beans that is being provided in the Department of Agriculture, which has rich in iron. We also have the zinc. And in health department, they actually take care of their malnutrition to see to it that all those mothers attend the antenatal clinic so that at least they give birth to healthy babies. So that is what we actually do in Bomet, that is providing the high iron beans, the mothers, and even the children. Remember, the developmental stages of a child is between 0 to 100 days. That is where we have the developmental stages of a child that actually guides the children in developing. So the lessons to the LREB is that what we actually do is that these departments, apart from being there, we actually remember our colleague when he was talking about the budgetary allocation because it's about financing. So we actually incorporated all the departments, that is the multi-sectorial department, multi-sectorial approach, so that each and every department provides a 2% of their budget for the actually school milk feeding program. And this has gone a long way. That is, we started this one in 2020, when we started the milk feeding program, when the governor was on his first term, and it has been running. We also have the challenges that we have been encountering. That is what he has said about maybe the disbursement from the national government, since we have G2G, approach in the KCC where we get the milk. But what we are doing as the county government also with the help, our governor is working around the clock. We are doing our own cooperatives that will be able to provide milk for the children, and we are working to it so that we can see that we have that. So to the lesson to the LREB departments or the LREB teams that it is actually a multisectorial, that we need to actually unite all the departments so that we can be able to accommodate each and everyone, because we look at the population is actually growing and the higher population is at the lowest age. So we need to take care of that one. So it involves all the departments to take into control or to take into action so that we can be able to have everyone on board. That is what we can say. Thank you.
Thank you, Waziri. Thank you for the response that you've given us and showing that indeed it is possible for all counties all departments to plug into a specific program, like it is very successful in KMET County. Allow me at this point to recognize that the governor for KMET is online and is listening and has just listening to Waziri talk about KMET County. So perhaps if time allows, we would also give him an opportunity to give a remark. Thank you so much for that. I would like to build it up from where Waziri has left and travel all the way to Siaya County. And knowing that whenever we talk about ECD, what comes into mind first is usually the classroom, isn't it? So if we have the infrastructural development, is it possible that we can view ECD, not ECDE, as beyond the classroom? So then how can the Lake Region block counties reposition early childhood development and education as a comprehensive child development investment that goes beyond infrastructure and ensure our systems will still deliver quality, nurturing, and equitable outcomes for early childhood development?
Thank you, Easter, and everyone. Greetings from the county government of Siaya. We are glad to be here and to offer insights into the discussion. Now, in Siaya, our approach is also multisectoral, where we have all the departments involved. And our nurturing care in Siaya is governed from the Department of Governance and Administration. And we have a team which is called ECDNeK, the Extended Smart Start Executive Committee, where all the CACs are members. So in terms of investment, the investment comes from all the departments. So we have increasingly framed ECD under that multisectoral approach, and we link the ECD centers with the health outreach and nutrition. We have recruited a number of teachers on permanent and pensionable basis, and they're all professionals. We have infrastructure expansion with learning materials and solution systems. I wish to inform us that Siaya is currently 80% in developing a state-of-the-art model ECD. It is stationed in Bondo. In the next few months, we'll be having that institution and running. We expect that that institution will be a model showcase for all ECD in the whole country. Now, in terms of shifting from classroom to child development systems, we agree that the brain of a child develops between the ages of 0, that is at conception, up to 1,000 days. So it is not all about big and mortar. In terms of development, we wish that the action that we will recommend to all our colleagues and in all government. First, regular teacher recruitment and stabilization of payroll. We talked about exchequer releases. We have teachers, we need to pay them because we're going to use the language of finance people because the money has not come. we need to strengthen that aspect. Two, we need to institutionalize continuous professional development. That means we keep upgrading our teachers. And three, let us have indicators in our annual development programs beyond brick and mortar. The psychomotor development of a child mostly is not on the building. The children learn more in visual things that they see and things that they can touch. So in CIA, we insist that beyond the brick and mortar, we will get into the psychomotor of the child. And then we talk about the school feeding. What we have in CIA is fortified porridge. Fortification means that all the nutritional requirements are inside the porridge. It is not just porridge for the sake of it. So we can be able to have child developing out of that school feeding program. And because we said we are multisectoral, we also include the agriculture food chain. All the ingredients in our fortified porridge come from our local farmers. So it also improves on the agriculture food chain. So lessons to learn from us to LREB and maybe beyond LREB. We would wish that our counties develop a unit, which we call a multi-coordination unit, whereby you have the health department, you have agriculture, you have water, sanitation, education, social protection, infrastructure. Then all that is governed from one center. So that when we budget, we all budget in one setup that can be able to improve on our systems. Thank you, Mr.
Thank you, Waziri. Thank you so much. We have talked about what we are doing to the child in Konoin, down to the child perhaps maybe in Murmalanga, in Siaya, on Nisi, or Chianda. Now, allow me to take it to a child somewhere, maybe in the deep heart of Kisumu County. And today, Waziri wears two hats, representing our chair, the LREB Region Economic Bloc Chair, and also representing the leadership of Kisumu County. And so what we are putting in mind for Waziri is how the Lake Region Economic Bloc counties can focus on costing, financing, and prioritizing early childhood development, because that has been the greatest challenge. And as we look at that, we are to focus more on what are the key non-negotiable interventions that should be costed and prioritized in county planning document. So as you speak for Kisumu County, you also speak for what we can pick as LREB and also what the rest of the county, because people are watching what we can pick for the rest of Kenya to support our children. So over to you, Waziri.
Well, thank you, Esther. Ladies and gentlemen, I take this opportunity also to welcome you to Kisumu County, because this workshop should have been presided by our governor, but because of official commitment he has outside the county, he requested me to represent him here. So please feel welcome on behalf of our governor. And I would want also to thank you most sincerely, because you are here on behalf of a very special member of the society that cannot go for a workshop.
Yes.
The kids,
Very true.
we must always do it for them. And so I think you are doing a good service, and we must do it to our best, because a speaker here made a statement that if you change the beginning of a story, then you change the whole story. And that is exactly what we are handling, because we had a story which must be changed from the beginning. Because if you are very keen, you will agree with me that we have done serious disservice to the kids of this country for a very long. Before this devolution, there was nothing for the child. Till now, we now started, and that is why you can see there are a lot of challenges which are coming out, because these things seem to be very and kind of an emerging issue to majority of the stakeholders. So thank you very much for sacrificing your time here. Coming to your concern, I would want to state here that in Kisumu County, the department that is in charge of the ECD is called Education, Technical Training, Innovation, and Social Services. And so we have a directorate of ECD. Within that directorate, we have the director, then we have the team that he has in the office. And then we also have SESEC. SESEC is County Early Childhood Education Committee. Below SESEC, we have Quality Assurance Committee. And then below it, we have now our county coordinators that are collecting all the concerns and those data we are talking about, the monitoring and all those other activities, and bring to the quality assurance, go out themselves, get all those concerns. Then their finding is presented to the SESEC that meet on quarterly basis, and then now present their report to the governor on quarterly after their meetings on regular basis. And so when we are talking about financing of our ECD, and if it has to be done well, you must really engage the system fully. In Kisumu County, we always ensure that we align our activities and programs for our CIDPs to our ADP, and also in the fiscal strategy papers, so that even when we are to go along to engage any other partner, they must find that the level of engagement is also captured officially in our documents. In Kisumu County, we have also gone to establish our ECD Act and regulations, which is ensuring that the programs and activities that are priority are enhanced within our budgeting process, so that at every budgeting process, we are sure and certain that our location for infrastructure is given as agreed upon. Our location for staffing issues like the salaries and the recruitment of our ECD teachers is captured as planned. And there are figures that would want to use for feeding programs and teaching learning materials are captured. These are things which are known, and we don't debate about it with our finance department, because they are captured in those instruments. So I would want to say that for the Lake region and even beyond, we need to ensure that we prioritize the activities that would want to be done for the kids and fight for it. what I know, as was presented here, the budget process for counties always go a long process. And sometimes you find when challenges come along the way, you will always find even supplementary programs come in and they slash a bit. And sometimes, just as we are saying, somebody somewhere is likely to say, and we slash also for the children. So if you ensure that whatever location for the child is not to be slashed, and you would make sure that even when he's going for the approval and application at the county assembly, you lobby and make sure that the allocation for the children remains contact. That is what we have done in Kisumu County, and it has helped us to some extent.
A round of applause for him. Thank you, Waziri, and thank you for highlighting what is very key in terms of the policies that have been supported in Kisumu County. Of interest is the Children's Act, the Kisumu Children's Act that has been developed from the Children's Act 2022, and also considering that there are regulations to it that now support implementation. So it is very important to also note that all this that he has been saying are very well articulated in the county integrated development plans. We also have the county fiscal strategy papers and the ADPs, and also the AWPs, the annual work plans are moving forward, because from what the speakers are saying, there's a lot that is happening on the ground. The county governments are doing quite a lot, but we are still not yet there. There's still a lot, considering the presentation that was made, even though it was speaking from a lot of data from KDHS 2022, we know that a lot is happening, but yet we are not yet there. So that is where we bring Oscar on board to look at the missing link. What are we missing out as county government? So what is the general missing link between policy and practice in advancing nurturing care for early childhood development? Then aside from that, would you also speak to whether we can have a particular framework for action that can bring together or catalyze county government towards investing in ECD? You've also heard how Waziri has talked about how often the budget for children is slashed to take care of other competing priorities. So how do we do all this as county government? Over to you, Mr.
Thank you very much, and it's a pleasure again to be able to speak to you, this esteemed audience here, and those following us online. Allow me to begin by, first of all, just doing something that is in line with protocol. One of the board members of the ECD network is here. That's Pat, and that's Dickens. I just want to recognize that you're with us in this room as a board of directors member. Thank you. Yeah, so let me begin from where Eunice ended. Eunice ended by saying that our problem is that we do not have an investment case for ECD in Kenya. Someone asked, I think, a very prominent leader in this country, what does it cost to educate a child? And the answer was, we don't have any data. So how do you finance that? How do you fund that? Policies can be in place, but unless there are actual figures that we can actually, we can work with, then it becomes very difficult for us to move forward. Allow me to give the example of investment cases that I have led to develop for a couple of countries. I led the development of the investment case for Tanzania, for Rwanda, and for Burundi in ECD. The result of which is that in those countries now they have figures that they can actually pin government down on and allow for this financing to happen. A short while back, again, I had an opportunity to work with the Department of Basic Education which was charged with leading the work of ECD in South Africa. The result of which is that that review, once government was made aware of the fact that 17 rand were not enough for educating a child in South Africa, President Ramaphosa himself actually spoke at a national convening and increased that to 23 rands per child, which was less than the 30 that we had proposed, and that country has moved forward. So what am I trying to say? Unless we know what we want to fund, then policies will continue to remain on paper and they won't be put in practice. So what I would also like to caution against here is that if we go into any budget and look for an ECD line, we might not find it because ECD is multi-sectoral. So when I made my presentation earlier, one of the things that I did mention also was that it is necessary for us to be part of the budget sectoral analysis, to look at where the money goes. Instead of us just talking about, that cash was allocated, we also want to go to the place of being able to say, what is it that that money did in terms of improving the outcomes of children. On a side note, again, before I just go into showing how we have made this work, I would like to also mention that if the leaders of this country, including yourselves, took time to just read papers on adverse childhood experiences, adverse childhood experiences. And I'm saying this again, adverse childhood experiences. Then you would understand the long reach of early childhood development. I've said this in many forums that the child is the father of the man. And you sitting in here are actually a product of your childhood. When investment is not made to enable you to actually thrive and move from just surviving, then there's a challenge there. And so what can we do practically? We have basically talked about a lot of things going on in the country, and I want to just show how we can make nurturing care for early childhood development work. At the end of which, my sister Monica, I'm going to ask that we actually write back to the faculty that trained us, that the project we designed one afternoon in a cold winter has actually been taken to scale, and we now need to receive our master certificates. Yeah, so that is something we should do. So the first thing we need to do is to strengthen services and integrate. And this is something that we did when we began modeling this Smart Start initiative. And we looked for pathways, existing platforms that you could actually make nurturing care get embedded into. And one of these is primary health care. It's a very critical area where you can utilize existing health platforms just to make it possible for us to be able to, using routine visits to the health facility through PNC, ANC, and so on, you can actually make it possible for us to build the capacity of other communities that work with children. The second is to adopt the Care for Child Development package, which is something that has been done, I think, across most of the counties that we are dealing with here. The Care for Child Development training package has now been adapted for Kenya, and it will soon be launched. I think we just finalized that activity about 2 weeks ago, and that is going to help in terms of building caregiver capacity in building their relationships with children. Friends, when you are raising a child is dependent on an adult to be able to thrive. If the adult is incapable of providing that care, then the child cannot thrive. The situation we are having in our country right now, even with the leadership talking to people and finding themselves getting abused, being told stuff, is a result of not having good interactions with our children at the early years. The third thing is to ensure that when we are providing support, and remember I'm talking about strengthening services and integrating care. Here, there are there's a three-level model that we adopt. There's the universal support that is given to all children, which means that we all understand that all children need some support. All children need some support. And then we have that targeted support that goes to them. So we moved from universal to targeted. Targeted meaning that there are those children who need additional support. there is additional support needed because they are either lagging behind developmentally or they are not in a place where they're able to thrive as expected. So unless we target those ones, again, we will fail to achieve the outcomes that we are working towards. And remember that there's one strategic development goal that we are working towards, that children under 5 are developmentally what? On track. That is 4.2. And if we do not do that, then we miss out on those children. And then there is that group of children that need what we call indicated support, specialized support, children with needs that are actually different from those of other children, around being able to, catch up with their peers or being able to navigate their disabilities and so on. We need to be able to focus on those children because they're a component here. And therefore, in our programming, we have always made sure that that is also taken care of. So 3 levels: universal, targeted, and indicated. And this is part of what is modeled within the nurturing care framework. Then the other thing is around leading, investing, and formulating policy. So when we talk about multisectoral action, it just simply means that we plan jointly, we implement by sector, and then we monitor jointly. I know sectors need to keep their spaces. That is important. But what we need to understand is that we can plan around one child, all of us, and then implement by sector, and move from implementing by sector to actually monitoring jointly. And that way you begin to develop what we call polyvalent workforce. You and I are capable of monitoring what is going on in education, even though you're not an education person. You can see what's going on in child protection, even though you're not a child protection person, because your capacity is being built while you're working. And then I will also mention, just in passing, that we need to also look at how we can basically work around social protection policies, the cash transfers. What are we doing in that particular regard? Have we added anything in terms of what we are moving down to the vulnerable households? If not, then it means that we need to get into spaces where we can influence that to happen. I would like to mention that we also need to focus on families and the communities within which they work. So empowering caregivers. I love it when I go to Siaya and I see Nyathie, Miemise, Motegnochon. Isn't that so? Yeah, that's what we would say. So the community imbibes that and begins to speak it in the churches. It begins to be a message and everybody knows. So you have empowered caregivers, engaged communities, and then you work towards supporting their mental health. For those of you who are aware, UNICEF already is running the caring for the caregiver curriculum training. And I think there was a training here in Kisumu last week. Yeah, so that's what we need to do to be able to also take care of mental health. A mad person cannot develop a good person. I didn't say anything. Number 4, we need to monitor progress and use data. Friends, I think we have a lot of AI available right now. We have data tools that we can use to track indicators. And recently, I think we will be told about this later on, the Global Early Childhood Development scale that was developed by WHO and the UNICEF Early Child Development Index were used in a recent pre-KDHS survey. And we'll look at the data around the early years, what it is telling us in the counties that were visited. And we need to also implement surveillance. I think one of our challenges is we wait for these children to be brought to us when it is too late. So in communities, when we are implementing, we need to actually work with the community health promoters and those that are within the community, those who have a reach in the household, to monitor when developmental domains or milestones are not being realized. And finally, when we think about local solutions, let's give agency to the community. Let them be the ones that design. Don't go there with parachute minds. You are coming in with an answer to your problem, and I have not told you I have a problem. So first, listen to them, pass power and the ability to make the decisions to those that are at the level of managing the child. And then also, I would like to say, in part of innovation, please adopt digital solutions to some of your training programs. With that, I just want to say that again, finally, make sure that you bridge evidence with bridge the divide between evidence and implementation by actually making sure that you have science in the research work that you're doing. And I appreciate that. Thank you.
Thank you so much. A round of applause for him. Thank you. I want to take this opportunity to really appreciate the items that you have outlined. Of particular interest is the targeted investment that we are supposed to be putting across county government. And many a times there are children that are somehow forgotten about. So as we do all these programs, we need to be focusing on the children with needs. The one thing that I've also liked is the idea of polyvalent workforce that would really make the strengthening of the multisectoral sectors that many counties have developed work very, very effectively. And so pushing it also from policy to focus in communities and particularly in the families. At this point in time, we have had quite a broad form of discussion. I'd said earlier that we have the governor for Bomet. If we would allow him to speak, we will be guided by the teams that are working technically. Aside from that, we have very limited time. I've been informed that we've gone past the hour. And so we would allow for questions from those who are with us virtually, just 2 or 3 questions. And then I'm being advised that the governor is okay with giving remarks. So we just allow, once he's on, you will alert us and let us know. Aside from that, we have people who are watching us virtually. So we are allowing for questions from the virtual team. And then we will get questions from the team that are physically present with us here. So from the in-person teams, we will allow for a bunch of questions because we are here, we can talk to the panelists directly. So in the next few minutes, do we have anybody online who would want to ask the panelists a question? There's an online question.
Thank you. You can hear me. Thank you very much. There are several questions, but just I'll just give 2 that speak to issues that have been discussed in this panel or before. There was a request for a case study on finance or accountability mechanisms to ensure quality services for all young children and young people from the county. So they want a case study in the counties on how financing and accountability mechanisms have been done effectively. There was another one on SDG 13 on the role of climate change action in Kenya. Thank you.
Kindly repeat the question. We lost you at some point. Please repeat what you have asked.
There is a question on a case study from the counties, if any, about how financing and accountability mechanisms have been used effectively to ensure quality services for young children. That may have been mentioned, but in case there is another, it can be shared. And then on the role of climate action with regards to Kenya's role as a strategic continental advocacy around SDG 13. Thank you. Back to you.
I would request that we would have any of the panelists to address the accountability measures for the county government and how effective they are. Perhaps I would give it to Waziri from Kisumu. Oh, we are guided that we take all the questions. There are other questions. Proceed.
Okay, my question, or this could also come as a comment, is whereas we're focusing on all children, there's a high likelihood that there's much more focus on children in public schools. So just good for us to note that there are thousands and hundreds of thousands of children in private early childhood development education centers. So even as we do programming, let's also focus on those particular segments. And lastly, to ensure sustainability, then that should ideally be government function, just going beyond pilots. Thank you.
Thank you. We can address the two questions on accountability. And then the other question on public schools, being a focus on public schools. If it is a feeding program, then we are likely to focus on public schools and forget about the private schools. So we'll have Waziri Edgar address that. And then Waziri on sustainability. Waziri Agnes, you can address the issue on sustainability. And perhaps maybe all of us could work on one item on sustainability as a kicker later on. So let's go to Waziri Awiti.
Oh, thank you. In Kisumu, issues of accountability is taken very seriously to one extent that we have elaborate arrangements with various departments to ensure that the little resources that are used for ECD are well taken care of. We have departmental reporting. There is a department of ECD. The director of ECD reports at given period on the plan, the budgeting process, and everything that is in place. And in the budget process, we have arrangements with the finance department. We have arrangement with the county assembly where we are interrogated right from the initial stages up to the stage where the budget ends. Then we come to procurement, where the Department of Education County Assembly starts interrogating the procurement here. Then we go next stage to the budget department of County Assembly. So the oversight that the County Assembly is doing is well structured in a manner that up to the point that we are utilizing the resources and the outcome is well arranged and accounted for at every stage. Then we also have our internal auditing is very particular, and they check right from the quality of infrastructure at the site where the ECDs are. They liaise with M&E and check all that we are doing at any given time and give reports. And if there is any concern, then the department is called upon to respond before it goes to other stages. Thank you.
Thank you. Let's look at the next. Thank you for the response, Waziri. And indeed, it's also good to point out that we also have an oversight. The legislative the county assemblies also do a lot of oversight on the programs and the implementation processes across counties. So allow me to give Waziri Otumba opportunity to respond on the public schools given preference over the private schools, especially in some interventions.
Thank you so much. And allow me to mention to everyone online and present here that just 3 days ago, we had a mass meeting, all CECs for education in Nairobi, and that issue came up. And the question is this: to what extent can we use public funds on a private enterprise? Remember that those public funds have to be released through the exchequer. Does the exchequer allow me to spend public money to finance an institution where people are paying fees? Because as per the Basic Education Act, education is meant to be free at all levels. So it's a challenge. And one suggestion that we made was that then, if we must perform functions that are meant for national government, then the function of education then has to be fully devolved to the counties. Otherwise, as it is, there is a gap. Or alternatively, we propose a revision to the Basic Education Act so that counties or county governments then have a role in private institutions. We can then register the institutions, register them. We can then control the quality of curriculum that is provided. And then we can also be allowed to employ teachers so that private businessmen and businesswomen do not then intrude into our function, which as per Schedule 4 is primary education. As it is, it's a challenge that has to be grappled with. Now, as we are also discussing the same, one suggestion we have is that we need to allocate funds specific to pre-primary education, then ring fence it in the budgets so that when it comes to these issues of supplementary, the funds are not interfered with. But the question is this: as per the Constitution, pre-primary education is supposed to be devolved, which means that we take from national government. And the same Constitution says that the resources need to follow the function. So did the resources follow that function? Your guess is as good as mine. Thank you.
Thank you, Waziri. Thank you for that response, which also makes us wonder whether ECD is a public good or a private burden. Thank you. Waziri Agle?
Thank you very much. For the questions that we have, there is the online questions, and I believe also there must be also the questions that we have physically. But to join my colleagues in what we have actually said, what Waziri Daktari had just said about maybe the private entities and even the public schools. I think what we can only do is the county governments, what we have actually been doing, for example, in Bomet, when we're having maybe capacity building for the teachers, we actually bring all of them in board so that whatever they are doing, the curriculum that they offer, because they have the same curriculum. So we normally bring all of them in board so that we have all the teachers have the same content that can be able to actually bring on board. What we are talking about maybe the in the devolution conference that we had last year, when the policy is there, can actually be able to go a long way. The challenges that we have just said, what Daktari has just said, that it is as good as mine. We have been having the challenges of the teachers because the pay that we make in Bomet is not the same as the pay that we make in another county. This is mainly because of the resources that we were saying. If we have the functions that we do as the county government, because we have early childhood has actually been devolved. We also have technical training colleges have also been devolved, but now the resources have not been devolved. So we are saying if these resources are actually fully devolved, we can be able to actually sustain. But in our capacity, we are struggling so that we can see that it continues. Thank you.
Thank you. There's more. Waziri?
Thank you. I think there was also some concern about the blue economy, which I notice is going unattended. Yeah. For in Kisumu, on blue economy or climate change, we are very particular on a special undertaking, which we call kitchen garden, which we have made as a serious program for all our ECD centers. And we go to extent of sharing with the administration of primary schools to provide us with space. Of course, they give us space for the playground for the kids, but we also request for an extension to do kitchen gardening. And this one here has become very successful, except that in some particular situation, like now when the rains are too much, there are some pockets within Kisumu County where now the kitchen gardens are flooded and may create a bit of a problem. Because from that multi-sectoral ECD packaging we have talked about here, we engage the Department of Water to ensure that every ECD center is supplied with water. That is either borehole, they provide a tank or piped water to every ECD center. In Kisumu, we have gone slightly further than that by working with a partner that is now helping us to do water purification. And when we have come to find out, ladies and gentlemen, that even some of these waters we take here can still be purified further because they have not reached that other level. And we came to learn that when water is properly purified, it has a special taste. It's very nice. And the children would want to take water all the time.
That's quite interesting.
Yes. So in Kisumu County, the fact that our climate and we're also very close to water, there are also specific centers that we have aquaculture. We are having fish ponds, and during the harvest, the children are changing diet. And we have come to find out that during the harvesting period, the attendance is very high. It's always 100% because the kitchen garden is veggies. But when now harvesting is done on fish, you change by a diet to come to fish and things like that. So we are doing a bit on this, and we are very happy that progressively we are going to reach every center so that the vegetation, vegetables is not an issue in our ECD centers. Thank you.
Thank you. Thank you. You have a comment, Oscar?
Now, mine is just to draw attention to a recent study on the effects of climate change on caregiving. Of course, most of us are aware that we see a lot of statistics on how floods disrupt schools, heat wave, how it is that drought causes an increase in malnutrition. So a recent research that was undertaken by Samuel Hall, it's a consulting agency, and Uthabiti, did find out, they actually made one statement. When childcare stops, everything stops. And the question they asked is, who is it that actually stays with a child when the child gets sick from contaminated water after floods? Who stays with the child? The mother. Isn't that so? Who repairs childcare centers damaged by storms? Who repairs them? Yeah. Who walks further for water during droughts? Who absorbs the economic shock when families cannot pay for childcare fees? Nasikia hiyo? And a lot of these things have to do with climate effects, the climate change effect. So they needed a couple of things to happen. That you reduce caregivers' climate burden, redistribute responsibility, represent caregivers in climate decision-making spaces, and also reward caregivers, fair wages, social protection programs, through social protection programs, and also recognizing the women or the caregivers as being climate leaders. So there's a study that was done recently, and this is out available for you to read if you want on the Uthabiti website.
Yeah. Thank you for highlighting that. Allow me, Waziri, to give opportunity to Governor Barchok. His Excellency Barchok is online and he would like to give remarks. So welcome on board, Your Excellency, Governor for Bomet County. We are ready to listen to you. If you're muted, kindly unmute.
Yeah. As the governor is coming online, I just forgot also to mention that we have a policy that any contractor putting up an ECD infrastructure in an ECD center, after everything is done, it's a policy that they must plant 200 trees within that. And right now, the director is here. He has given directive that now we are changing to fruit trees, which is compulsory. Before you plant 200 trees in the center, we don't qualify, we don't sign those contract papers so that you are clear.
Okay. Are we ready to listen to the governor? It's not yet onboarded. So would like to allow for questions from the audience. It's very important. We've listened to very many good things going on in the counties. But later on, I would also wish that the panelists give us one item that they would wish to do to promote sustainability. So we can have a few questions from the audience. Could somebody help with the mic? Sheila, kindly.
All protocols observed, Dr. Angeline Piroi, CC Health and Sanitation at the county. I'm appreciative of the coordinators and the planners of this meeting today. It is very striking to note that we are talking about 12 million residents of LREB, that today's discussion would favor them.
And I will present 3 points. Some of it are just points to note for the team. For Nandi County, we passed our nutrition policy 4 weeks ago, and we are behind CIA and Bomet in terms of implementation of the multisectoral approach to supporting ECD nutrition and health in our county. But with the policy in place, we have started working together to ensure that we have common financing in terms of allocation of resources. I want to mention that as much as we're asking for resources from national government, we all know that there are challenges. There's need to improve our OSR, on source revenue, because with it, we have a lot of flexibility as counties, because that is your own resources. You can actually allocate and appropriate as need is demands. And this would be easily achieved through digitization of our revenue streams. And this has become very clear with digitization of health services. Today, we are able to account for our resources, including staff and even the consumables. And we are able to see that the revenue from health is actually visibly increasing from time to time. The other thing that is important for all of us is that there are realities that we face today. I think our economy and others have been faced depression due to COVID-19. Shortly now, we are going to face a challenge with the transition of financing of malaria, TB, and HIV. And this is a reality that is likely to shake all of us, even as we talk about the financing. And this demands that we critically remain aware and look for opportunities to improve service delivery. Because without good quality health for our children who are mostly faced by malaria, then we find that achieving the quality ECD might not be realized. There is another reality today. There is war that is ongoing. That war is likely to affect all of us. I think we may not have felt the impact as much, but it's coming. That the cost of goods and services is likely to go on. Are we prepared as counties or even the LREB group of counties to face this? These are the challenges that can be a part of nature as we face a lot of rain effects in the last 1 week. I would wish that we also focus on quality food for our children. I know we have improved on K-wash sanitation aspects, and we have reduced microbial contamination to some extent. But then there is an aspect of chemical impurities in our food. The food that we feed our children, how has it been produced? Are they coming from greenhouses with a lot of spraying that is done? Is that food safe for our children? A lot of snacks in our shelves, they are high energy density foods. They are not good for our children. How do we change the behavior? And I know very young children are very good. If the teacher tells them not to take soda, not to take, a lot of sweets, they might listen and even influence their parents who purchase these foods as a way of making them happy, but they are not good for our children. And we see young teenage girls today who carry pregnancies and they are not able to have normal deliveries. A large percentage, up to 40%, have to go through cesarean delivery. Why? Because their developmental stages, they do not get adequate bone health and bone growth. Their pelvic floor is not adequately developed. And if you trace back, could be the nutrition that we exposed to them to early in their lives. So these are some of the discussions that we need to create opportunities for sensitization so that as we talk about that early childhood life, we improve on their health, we improve on their nutrition, and ensure that they develop well. Lastly, touching on health, we know that vaccination responsibility or acquisition of vaccines and procurement is now purely a responsibility of our national government. And all of us are aware that for once, we've faced delays and shortages in vaccines. So those are some of the things that we need to put into perspective. Asante.
Thank you. Give us your name.
Dr. Angeline Kirui.
Thank you, Dr. Kirui from Nandi County. And thank you for the insights and sharing with us what we can do differently as county government. The one item that I picked clearly is the item of digitizing revenue streams and the cash flows for county government. If that is done effectively, then the PPPs that was earlier talked about can be very effective so that we don't solely rely on the partners or donor funding or purely the government, even though it's their mandate to do this. So that kind of sourcing or resource mobilization would be very, very effective. We are allowing for more questions.
Yeah, thank you very much, Madam Moderator. I gather you are Easter, rather. My name is Hilary Masai. I'm from Bungoma. I'm the director in charge of ECDE. One that would maybe directly go to the panelists and maybe just wrap it up with the earlier presentations is the issue of a milk program in Bomet. That milk program is quite exciting. And as one of your presenters said in the morning, I think I feel sexed enough to talk about ECD issues. 2%, she talked about 2% from every department. We come from counties, and as the Honorable CECM from Siaya did put, where we have people from finance. People from finance are initially from the Gender, Culture, Youth and Sports Department, where we run a sports program, cultural program called Kikoska. And our efforts to get other departments to come in became very difficult because you would be told in Bungoma, there's a term that is gaining traction. I wonder what's happening in your counties that is called domiciling. Yes, you would be told that this is not domiciled in our department and therefore does not have a budget line. So that in essence, then the multi-sectoral approach to ECD becomes a very big challenge. So I was just wondering the mechanisms and the convincing language, and if the PFM that is being implemented in Bomet is any different, so that you have a buy-in from other departments to give 2% of their budget for their milk program. And maybe for the larger audience, and I'm talking to Oscar also as our lead person in terms of the ECD space. In Bungoma, we call it the ECDE. And maybe Waziri is here, Honorable Agnes, Engineer Agnes Wachie. Maybe that's where we lose it, Waziri. Maybe we should call it ECD and E. So that now you are bringing in all aspects of early childhood development. And of course, we have the aspect of education. The problem actually that we have is financing. And Oscar did talk about the global 1% use of our budget for the ECD, and maybe 10% to education, which I've ably said should be earned education. We need a convention in Kenya, an ECD convention, so that one of the declarations from that convention then would say this kind of percentage, and maybe that would give us latitude to have a reference. Because if you talk about, for instance, women issues, you would always refer to Beijing and the declaration thereof. Or if you're talking about climate issues, you would talk about the Rio or these other internationally, do we need a national convention, and then maybe put it as a recommendation, and use all the fat languages that we know, so that then we would refer and have a buy-in from excellencies, the governors, so that they would put. Because as matters stand today, you are given, and I liked what Honorable Awiti said, that in Kisumu, some budget lines are not negotiable. But even when they are not negotiable, what happens is that during supplementaries, and my English, I'm an English teacher teacher of English of about 14 years, tells me that supplementaries to augment, to support. But it's only around our counties where supplementary means reallocation and actually losing money and not gaining money. I think there should be a redefinition of terms so that we don't call it supplementary, as it were. Because today, even in Bungoma, apart from salaries and these other things, we also have quality assurance and standards, which is a standalone. We have within my directorate, we also have staffing. Now, when we are doing quality assurance, that is where the private sector comes in. We have to find out what they are doing, because it's possible that they're offering education, but we are not sure about what they are doing there. So quality assurance is not just for public schools. In Bungoma, it's also for the private schools. And finally, Waziri from Siaya. There's been a lot of talk in other blocks about model ECD centers. You talked about a model ECD center in Siaya, which is a state of the art, to just borrow your language. And already Muranga and Kiambu have been the talk of the country. I was wondering, are you doing a one-stop shop? Because what we now have, Madam Moderator, are not even ECD centers. What we have are ECD classes domiciled in our primary schools. You know,
Yes.
so how do we navigate that space? And if the model that Waziri talked about is going to be replicated across the county, because if you have a model, then it should be present in every part of Siaya, every part of Bungoma, and indeed the LREB region. Thank you very much.
Thank you, Hilary, for the very informative comments that you've given us. I've been guided that we are running out of the online time. But there's a bit of responses that we need. You've talked about a convening or a convention, which ECD network has been doing very, very effectively. At LREB, we also have very many platforms and where we talk about early childhood development. I want to redirect the questions or the observations that Hilary has made as a part of the summaries that we're getting from the panelists. To Oscar, initially when we started having this discussion, you talked about counties, the need of counties to develop an investment case. So perhaps maybe you can summarize and tell us how perhaps we can do that and whose mandate would it be for county government. And then Waziri Awiti, you talked about very many innovations that have happened in Kisumu County, some which are yet to be scaled up. So perhaps maybe identifying some of the innovations that you have, what is it that we can effectively, and this would also go to Waziri Agnes and Waziri Edgar. What is it, what is the one creative approach that we can use from the pilot to national impact without losing quality? Because there are many things that are going on in the counties, but over time we lose quality, we forget about it. Right now, we know that we've been rocking this child in the cradle, but we don't know at what point maybe it can step out of the cradle and be lost somewhere. So what is it, the one item? What is the one creative approach that we could use that would support us to scale the pilots that we have without losing the qualities that have been initiated, especially by our implementing partners. So Oscar, you'd summarize. We could have Waziri Edgar, or Waziri Agnes, and then Waziri Awiti. Then Oscar, you summarize by showing us the how.
Thank you. I think it is known and accepted countrywide and worldwide that in governance, a multisectoral approach to issues works. It has been tested and it works. The best in terms of counties, like we did in Siaya, embed that idea in the CIDP and let us adopt a top-down approach. For us in Siaya, we are guided from Department of Governance. The governor is the champion, the first lady is the patron. So once you have that buy-in, then it's easy for the rest of the other departments to put in some funds in the budget. And it works. It has been tested and it works. Briefly on the model ECD, the one we're building in Bondo, it is a standalone. That model ECD has classes for PP1, PP2, the playgroup. We have a playground. We have a library. We have a computer center. We have offices. We have a parking area. And we have a place for mothers, they're called breastfeeding area. And we also have classes for people with special skills. Then we have a hall, a training hall where we'll be doing capacity building for teachers, where teachers can go for that in-service extra training. So in essence, it is school within a school. It's not just the normal ECD classes that we have. It is a standalone and will operate as a standalone like that. We are building one in every sub-county of Siaya. Siaya has 6 sub-counties, and we hope the same will then be replicated throughout. Because I will not speak again, I have been warned that time is going. I want to quote from a guy called Frederick Douglass that it is easier to build strong children than to repair broken men and women. I'm sure that a number of us here are already broken men and women. Let us do the reverse thing.
Thank you very much. I just say I am so glad for this webinar and the plenary session that we have had. It is just an informative that we need to go and look back, because that is the beginning where we begin all that. In this natural care and even fall session that we have had about our early childhood development or early childhood education, we actually need to actually carry. It is everybody's responsibility that we have to take in. When I was recommending that in Bomet, we are having it. This has been actually championed because we bring on board all the departments that they know they are supposed to take part in it. For example, in the transportation of the milk, where we are having the border guys taking the milk to the schools, transporting the milk. So in that case, the Department of Trade, and then we have the cooperatives, and our governor brought in board all the border circles so that he gives them the support, and they are registering in the circles, they can be able to be actually sustained. So that is why all the departments love it, because we have the youth department will come in, because those are the one involved in the border. We have agriculture coming in, and then we have also the other departments that are coming in. So we want to say, let us take up as everybody's responsibilities, and we know that we're going to make it, just like what I've taken in that we have in Bomet also the digitization of the revenue collection. I know it is going to work, and actually having everybody accepting that we have to pay actually our dues to help in our government. So I want to say, let's take up the initiative and have our children well fed. But it is not about the children alone. We start with the mothers, because the mothers are the one who bears the responsibility, so that when they are well taken care of, our communities will be able to live again. Otherwise, thank you very much. Thank you and God bless.
Thank you. In Kisumu, our department also housing PWD issues and sharing with the members of the PWD. We have come to find out that a good number of them are in that state because it was never discovered at appropriate time. That means, in fact, that is what Dr. Tumba is talking about, that we are already broken. When the foundation mistakes were done at the foundation, nothing was discovered. There's nothing that can be done to do the repair. So in Kisumu County, we are specializing now on special need training for our ECD teachers. And we have gone further to sponsor a good number of them in the training colleges so that we are able to detect these special need cases as early as possible, and they are placed where they belong, or if it's normal, the health department will advise, and then they are integrated. Because what has come out, and we do quotation a bit. If I also quote Wole Soyinka, he said that there will never be any replacement of the relationship between the teacher and the learner. So if you have a quality teacher that understands the child all round, then we'll be able to lay that foundation. Thank you very much.
Thank you. I proceed? Yeah. Okay, that's it. All right. So thank you very much, Hilary. I think I want to just speak from where you asked the question, can we have an ECD convention in Kenya? Yes. I think it would go beyond the ECD conference that we have. This is a bigger conversation. How do we do it? We have the IGRTC, that is the Intergovernmental Relations and Transition Committee that recently developed guidelines that are called sector forum guidelines. This is what the policy that is currently before Cabinet on ECD. This is the platform that it has taken to be able to bring together all arms of government, civil society, the private sector in one platform to speak. And I would say that once the policy is in place, it will be very easy now to convene that national set of actors and have a conversation. And there's a how in it. And I think I want to align that also to the recently released policy on devolved systems that government just cabinet approved last month. So there's a lot that we can actually back on, remembering that the ECD network only does what we call in terms of coordinating actors, but the responsibility of bringing these actors in that particular space for us to have governors, to have the ministers or the CSs and everyone else to take a authority that has that. And so the sector forums is one of the governance structures that we have put in the ECD policy, and that will be one that will actually convene. In terms of nomenclature, I think government is also very clear. It is we who get confused and still stick to ECDE. You will not find it anywhere in government documents. If you're talking about early childhood education, there is an Early Childhood Education Act, not an Early Childhood Development and Education Act. It's very clear. So it is we who confuse. When it comes to education, just talk about early childhood education if you want to focus on ECE. But when you're talking about ECD in and of itself, it already takes into account opportunities for early learning, which is part of what we call the education component. So we don't need to split it. I think, take it from us, we are the ECD network for Kenya, not the ECDE network. Thank you.
Thank you for the conference. Yes, to read the remarks from the governor. We were not able to
get hold of him because he was multitasking actually, being here and being also in another meeting. So we'll proceed with those remarks.
Okay, allow me to actually give the remarks from His Excellency. He sent his greetings to you people, and he was happy that he joined you. But I believe next time also he will still be there to make his remarks personally. Yes, I can say call to action, to regional action, the vision for LREB. Scaling Bomet's best practices across the Lake Region Economic Bloc, strengthen regional food security, child health, and overall well-being, positioning the region as a leader in holistic early childhood nutrition and development. What success looks like? Every county department owning its nutritional mandate, dedicating sustainable financing in place, children across the region thriving and reaching their full potential. LREB region recognizes a model for Africa. Together, the counties of the Lake Region Economic Bloc can build a future where every child grows up well-nourished, safe, and ready to learn. This is Max. And finally, making nutrition everyone's fair.
Thank you so much. We want to take this opportunity to specifically thank the panelists for today for doing a great job. We wish that we have somebody to organize a better club for them. Receiving from Bungogo, perhaps. We can do factorial, 5 factorial. Is that okay? And I think we all understand what the 5 factorial means. Okay, can we go? We start from 5 back to 1. Okay, let's go. Thank you. Give it to them. We're repeating again, briefly, as we wind up.
Sit here.
So, yes, before we go back, we also have a group photo. So you will have seen, we have had the discussions have been very, very fruitful. In my opening remark, I said we are strategically positioned to continue with this conversation with the support of the ECDNeK partners that we have at home. So at some point, we are always asked why we are still supporting the process indicators. At what point will we reach the child, the impacts on the child on the ground? We know that these processes must just be talked about because ideas will then be made and then resources are bound to follow the processes. So we hope that we will make follow-ups, especially on the remarks that have been made. And they're very key ones for the county government. I was very particular on how we are going to make an investment case for early childhood development. And that is something that we need to take home and see that it works, not only for your county specifically, but also for all the counties, the 14 counties that must all be included. Aside from that, we're looking forward to having these best practices within the region replicated in the rest of the counties. We know that we have other regional economic blocks. We know that partnering with the ECDNeK is HCDC. We also have so many others who have not been particularly focusing on early childhood development, but it has been working for us for the regional economic block. As a disclaimer, allow me to just clarify that LREB is a semi-autonomous government agency working just like the COG works, not really an implementing partner. So our role is simply to coordinate the platforms that we have, such as this, to coordinate all the activities effectively. Thank you, team. We would wish that we take a group photo and then we'll be released to take our seats. Thereafter, I will hand this over to Abella to give us the next action.
So we just request you to stand here at the panel and get this off. Then we have panelists first. They can juice. Okay.
Going on, we want to thank the online participants, and you're at this point you're free to leave as we take the photos with the leaders within the room. So we want to thank you so much for having taken your time, more than 3 hours be online. So thank you so much, and God bless. Stella, if you have anything to say, please come on. Online team, you're free to leave. Thank you so much. We do appreciate your time.